Hey everybody, my name is Matt Giordano, theyogimat.com. I've got a new video up on my YouTube channel, and I've got a lot of questions about it. It's about allowing your shoulders to lift when you take your arms up overhead. So in yoga workshops typically, or classes, typically teachers are quite often asking you to relax your shoulders, to pull the shoulders down the back, and that cue is super effective, and it's awesome when your arms are down by your sides, and it's really important at times. And I think the intention there is to relax the shoulders in a way, to let go of unconscious tension, in other words. And the downfall of that is when you take your arms up overhead, this mechanically just doesn't work. The reason for it is because the shoulder blades, they rotate with the upper arm bone in order for the arm to go up overhead. So I wrote about, or I spoke about this a lot in the YouTube video that I just posted, about that yoga cue that's maybe destroying your shoulders. And the thing is, it could cause a lot of issues like shoulder impingement syndrome, which essentially is like a pinching of all the soft tissue in the shoulder, where the humerus, which is the upper arm bone, where the humerus meets the scapula and the clavicle. This is glenohumeral joint. And the issue here is that when the bone hits, you have tendons and you've got muscles and you've got a bursa, which is a sac of fluid that exists in this space, in the joint space, and could irritate it quite a bit if you don't allow the shoulder to go up at the same time. Now, a lot of people are asking me quite a lot of questions like, well, I always ask my students to relax their shoulders when their arms are overhead. So, is this bad? And what I want to say is, like, most of the time, I'll say that students don't necessarily reach their arms up overhead enough for it to be a pain. So, like, here's vertical with the forearm. A lot of people are kind of here and they bend their elbows so their forearm looks vertical, but their upper arm is not. And when you do this, it doesn't necessarily impinge the shoulder because you're not really quite at a point where the impingement syndrome or the interval would happen, where the upper arm would pinch into the space. Now, the reason I bring this up and the reason why I've been talking about it a lot is there are tremendous amounts of injuries in the yoga world in the shoulder joint, and a lot of people are blaming chaturanga, and chaturanga could have certainly be a part of that, but it's not necessarily as, I would say, as irritating as something like downward facing dog is, where you're putting a lot of pressure in the shoulders and the arms are up overhead. So to clarify for a lot of people, what I want to just put out there is, if your arms are going up overhead, the shoulder blade on the back, it can rotate with the arm, and that's called upward rotation. And if you pull your shoulders down your back when your shoulders are naturally trying to upwardly rotate, you will hit the arm bone into the joint. You will irritate the muscles in there and the bursa sac. So you can get bursitis, you can get a torn supraspinatus is a really common injury that happens from this. But also a lot of your rotator cuff muscles run in that area. So and the biceps as well runs in that area. So you want to just let your shoulders rise up. Now, you can use the cue, relax your shoulders or pull your shoulders down your back. That's totally fine. Just do it when your arms are down by your sides. Do it when your arms are out to the sides, like Warrior Two. So this is the deal with this cue. So what I do in my workshops is allow the arms to rise up, allow the shoulders to lift up as your arms go up. And you can be dramatic about it. I like to be dramatic about it. I like to get people to energetically really reach through their arms and let the shoulder rise. And to be clear, what happens when you lift the arm up, a lot of people are lifting from the inner shoulder, and that's actually your levator scapula muscle that kind of pinches. It's the one that causes a lot of issues for people in the neck. And people are blaming it on the trapezius muscles. So what I'll say is, reach from the outer line of the arm from the triceps. If you reach from the outer line and you rotate the arm so that the tricep moves towards your face as you reach up, you see the little bit of space between my shoulder and my neck. That's the space that you want to kind of keep. As soon as that starts to go away, then we have some neck tension that probably doesn't need to be there. And that rotation, this is internal rotation when the arm is overhead. This rotation actually can cause the impingement as well. So external rotation with the lift is going to allow for the space in the neck and not as much tension in the levator scapula. So what I would encourage you to do, if you're really kind of watch the video that I just posted. It makes it pretty clear, and there's some arrows there that show you which directions and whatnot. But feel free to just in the comments below that video, put your questions down so I can be more clear and help you through this. And also, you can always send me a message, matt@theyogimat.com, and I'd be happy to discuss your individual questions about your shoulders or your students' shoulders. I'm happy to help you. And also, I just want to mention, if you're out there and you're wanting to learn more about anatomy and you're wanting to get this kind of understanding in your body, you can certainly email me there again, matt@theyogimat.com, and we can discuss maybe setting up the mentorship program for you. Might be something that you're interested in. Anyway, so if you are looking to learn more about the shoulders, go check out that video. It's totally free. It's incredibly helpful, and I look forward to seeing you all soon. Hope this was helpful and slightly clarifying. You can allow your shoulders to relax in most poses. That's totally cool. And in other poses, just when your arms go up overhead, let the shoulders go up. All right. Enjoy your day.